For Grand Rounds today, we have one of our own speakers, Dr. Alicia Asturias. And for introduction, turn it over to Dr. Wostrak.
All right, really quick announcement before I introduce our amazing Grand Round speaker. For the stocking stuffers for Family House, I will be making the rounds on Monday at the VA, Parnassus, the OI, and OTI. So just bring your filled stocking to one of those 4 locations and I will pick them up, take them to Family House. Okay, so it is my honor to introduce Dr. Alicia Asturias as our Grand Round speaker today. It's so fun to review your CVs because you guys are all so amazing. So let me just tell Dr. Asturias and all of our residents, you guys are amazing. You should just look at your CV once a year and you'll blow yourself away. But Dr. Asturias grew up in Sacramento. Growing up, she was very active in art and gymnastics. She earned a full ride scholarship to UC Berkeley for gymnastics. And by the way, did you know she was an NCAA Division I All-American? She was the UC Berkeley Female Athlete of the Year. She was a scholar athlete. So she kind of killed it in gymnastics. After that, she flirted with ENT. She was an MA for a couple of years, decided she wanted to go to medical school. She went to UC San Diego, and there, it's not a surprise, she was a gold humanitarian, I mean, shocking, member. She also continued her passion for art, and she was head of the UC San Diego mural project, which we'll see a little bit of today. We were then lucky enough to have her come here to UCSF. And since she's been here, she's been an absolute star. She won the Julius R. Crevens Award for Clinical Excellence as an intern. She's also been very active in research, and she's had several publications, including one with Dr. Feely in Gender Differences in Orthopedic Surgery Endowments. She has also been my partner in the Waste to Art Challenge, which was really fun. And I think she's also fooled every single attending when she's been on our rotation thinking she's going into our subspecialty. Like every single one of us, I think, has thought, oh, yeah, she's definitely going to do oncology. Oh, no, she's definitely going to do sports. Oh, she's so interested in spine. But that's just because she comes to work every day with enthusiasm, curiosity, and compassion for her patients and for her colleagues. She has chosen pediatric orthopedics, where she's going to have an absolutely stellar career, and we are so excited to see where you go from here. And we're also very excited to listen to your talk on ARThropedics and exploration of art and creativity. Welcome, Dr. Asturias.
Thank you. Thank you, Dr. Wostrak. I am obviously so excited to be here today. The truth is, I have been dreaming of this talk since I was a medical student. When I interviewed here, Dr. Vale said that he looked forward to the art that I bring to UCSF, which up until this point was really just a statue made of trash with Dr. Wostrak. And so I hope that this can fill in some gaps, okay? So as Dr. Wostrak said, the title of my talk is, of course, ARThropedics, an exploration of art and creativity in medicine and surgery. And our objectives today are simple. Number one, I want you to appreciate the art history of orthopedics. Number two, I want you to recognize that art is a powerful tool. And number three, I want you to embrace the relationship between art and science and the future of surgical education. And I want that to start in your practice. For an overview, we'll do an introduction. We'll talk about why art matters, certainly why art matters to me, and why it can possibly matter to you. Then we're going to go into the art history of orthopedics. Then we're going to talk about art as a tool in medicine and surgery, specifically for social change, for patients, for physicians, and ultimately for medical and surgical education. And then we'll close with some final thoughts. So, I am acutely aware that I am giving this talk to a room full of orthopedic surgeons who may or may not believe that we either have artists or not artists. We have folks who see the world in black and white, and we have folks like Georgia O'Keeffe who see the world in color. Now, what if we were to spend the next 45 minutes or so defining a space in between? where the best of art enhances the best of medicine, and the best of medicine enhances the best of art. Well, perhaps that's a space where art meets medicine. And that, ladies and gentlemen, is where we'll be going today. So, to start, I wanted to start with the color green. Does anyone know the significance of this particular green? Well, there we go. It's certainly worn by a lot of people in the department. But what you might not know is that this isn't just green. It's not dark green. It's not even forest green. Well, it's actually spinach green. And in 1914, Dr. Harry Sherman, a clinical professor of orthopedic surgery in the University of California in San Francisco, chose this particular green to visualize the operating experience of the surgeon. You see, at the time, everything in the operating room was white, from the walls to the ceiling to the sheets to the table. And Dr. Sherman found that incredibly distracting. And so the green scrubs at San Francisco General are really an ode to his influence, but more importantly, an example of art and color at work in ways that we don't even think about in our field, which will be a recurring theme throughout this lecture. Now, where did it start for me? So this is a picture of me when I was 4 years old. At the time, my preschool teacher told my mom, Alicia's gonna be an artist. Okay, so I don't know how she saw this abstract painting or these floral motifs or even this 1997 page-turning classic and thought to herself, this is real art. But I'm certainly glad that she did, because it turns out when you love something, you get the resources and encouragement to do it throughout your lifetime. And this isn't to say that my work is amazing, because it's not. And I'm certainly no Van Gogh, but I do have both ears and improved tremendously over the course of 25 years. What I will say, though, is I know what you're thinking. Alicia, the prophecy was wrong. You're a surgeon, not an artist. Well, I still paint with my cat, wearing pajamas and clogs. So no doubt, I think things probably still worked out. But if there's anything that I've learned, it's that pursuing multiple passions does come with challenges. But I think ultimately, creativity is what emerges out of challenges. And it's been the joy of my career in both thus far, really to meet that challenge with resilience through activism. So whether that's creating posters for the medical school after the death of George Floyd, or designing the UCSD mural project, when me and 30 of my classmates created life-size portraits of underrepresented voices in medicine, which are still up for permanent display at the School of Medicine, or even creating Lady Justice as the heroine of sustainability in our operating rooms. It's been wickedly fun to blend both of my passions. But I got lucky too, right? I landed at a place where on my first day as an intern, I noticed 2 original portraits on the wall leading to the ED in our county hospital in the lobby. Now, these aren't just any portraits. Well, the one on the left is by Frida Kahlo and the one on the right is by Diego Rivera. And on the left, Frida Kahlo depicts her most beloved doctor, who really functioned as her confidant as she navigated what we'll see as an immensely challenging medical journey that became her life's work. But it's not just the art we see, right? As I progress further in my surgical career, it's really the art we create every day that defines the overlap between art and medicine. For instance, we start with a sketch, okay? We propose a specific way of solving problems, perhaps a miniature plate, sometimes at 9 p.m. at night. And then we take that solution and we apply it into different areas. And we improve upon that technique. We push the boundaries of its applications until we perfect a style that people recognize visually as their own. And then we think, well, gosh, maybe art and surgery are not all that different after all. And maybe they've been intertwined since the beginning. So, what is that beginning? Let's turn to history, shall we? So this is shockingly an incomplete timeline of the orthopedic art history, and certainly a lot to take in. It starts from 2500 BC, and for simplicity, I promise we're only going to talk about 3, okay? So the first one that we're going to talk about is the tomb of Ipwi. The second one we'll talk about is Pompeii, the house of the surgeon. And then the last one, this mystery surgeon inventor. So the tomb of Ipwi was constructed in Egypt in 2500 BC. And this ceramic scene is regarded as the first depiction of an orthopedic scene, an orthopedic artwork. So Ipwi himself was a prominent building master, which meant overseeing the construction of buildings. Well, if we zoom into the right corner, you can see a well-intentioned Egyptian reducing the shoulder of his dear compadre as he looks away in agony. And team, this was chosen as the symbol for the Egyptian Orthopaedic Association. So, what else do we have? Well, we have Pompeii, the house of the surgeon. So this is a fresco from 200 BC. And what you'll see is that an arrow is being removed from the thigh of a warrior, not just with hands, but with an instrument. And you'll see that the soldier's facial expression appears to be in pain. And the presumed surgeon's is calm and focused. What's interesting about this painting, though, is that it provides a remarkable glimpse into the surgical practices of ancient Rome, but also the social implications of this profession, as the soldier is thought to represent Aeneas, the founder of Rome. Now, this isn't just a depiction of a mythical place, it's a real place known as Casa de Chirurgo. And it's an archaeological site where they've found early surgical instruments, including bone levers. Doctors, I give you the bone levers of 200 BC and the most interesting and versatile instrument in the operating room in 2024. Now, bonus points. Who recognizes this man besides Dr. Diab? I'll give you a hint. It's something that you use every day. If you said Frederick von Esmark, you'd be correct, okay? And while this is a nice charcoal drawing of him performing an amputation using his tourniquet, his original bandage is actually much more impressive. You see, Esmark was a renowned military surgeon during the Franco-Prussian War in 1870. And his original bandage was a solution to the massive casualties of the war. It was given to all Prussian soldiers and was a triangular piece of linen or cotton. It could be used as a tourniquet, of course, but it could also be folded or opened and applied in 32 different ways, all of which are pictured here. Now, it's remarkable, right? When you think about how much paper and words it would need to accomplish the same task, well, that surgeon's going to die on the battlefield reading a book. And yet, art can do it with 6 people on a bandana, because art's amazing, right? And art is a tool. Of course, brings us to our next section. So to start, we'll start with one of my favorites, art for social change. Okay? Does anyone recognize this part? See a lot of head nods. Where do we see it? The general, exactly. So excellent. Yes, it's in the breezeway at San Francisco General. And what you might not know is that it's from the Hearts of San Francisco project, represented all over the city. And what you might not also know is this project is actually an annual fundraiser that started in 2004. And since 2004, 131 hearts have been auctioned for millions of dollars to raise money specifically for San Francisco General. Does anyone want to guess how much money this project has raised? Any number. We have some confused faces. Try, team, throw me something. 100 million, I wish, a little lower. But $33 million. That's enormous, right? So feel free to give Frida Kahlo and Dr. Elosera a high five when you pass them in the lobby. And if you really want to take it far, there's actually an official SFGH art scavenger hunt that you can do in between consults and traction pins, which can be found on the main website. All right, folks. Well, what about this one? This one's a little bit more niche. Orthopaedics. Anyone recognize this one? Got some head nods. So this actually ran as the cover of the New Yorker in 2017. And it's an image created by illustrator Malika Favre titled The Operating Room. And you'll see 4 female surgeons at the center of a surgical scene, not a common occurrence at that time, or even sometimes now. And Dr. Susie Pitt, who is an endocrine surgeon at Wisconsin, was the first to notice it and recreate this image as a social media challenge. She and her colleagues, who are pictured here, photographed the scene and posted it using the hashtags New Yorker Cover Challenge and the I Look Like a Surgeon hashtag, which have since been used over 40,000 times. It became a viral sensation at the time and a call to action for female surgeons all over the world. It inspired everyone from local news to the New York Times to surgical journals, and even male colleagues who assisted and sacrificed their sterility on behalf of this exciting moment. And while it wasn't the intention of the artist to spur a movement, I love this. Sometimes an artist, like a surgeon, touches the heart of the matter. Well, isn't that really why we're all here? The heart of the matter for us is really our patients, right? This is our reason. How can art help them? Well, it is critical to start this section by talking about Frida Kahlo. Not only is she one of the most famous artists in history, but she's also one of the most famous orthopedic patients in history. And a perfect example of what it means to have access to art as a patient. So Frida was born in 1907. She was born with spina bifida, polio at age 6, and the combination of 2 left her with a limb-like discrepancy and weakness that she was tormented by relentlessly. At age 18, she was involved in a tragic bus accident for which I have consistent data to show that she had a missed spinal fracture, an impaling pelvic fracture, an open tib fib, a subtroche, and bilateral clavicle fractures. I mean, it's a miracle that not only she didn't die on the scene, but that she didn't die in bed of a pulmonary embolism. And not only did she not die in bed, but she actually painted for the very first time. So Frida's dad was actually a photographer and gave her a paint set when she was a kid. And after this injury, she reflects on that time as the first moment in her life where she actually had time to devote to art. And this is an image of her painting after that injury on an easel that her dad constructed so that she could use it while in traction. So over her lifetime, Frida underwent 56 surgeries, which included a right lower extremity BKA, countless spine operations, which she famously represented in her painting, The Broken Column, which is depicted here. And she also idolized her main spine surgeon, Dr. Juan Farrell, who she pictured here in her self-portrait. So art for Frida was her escape, her voice, and it can certainly function that way for our patients too. So there is a wealth of data to support the benefit of art and art therapy for our patients. We're not going to go into every single one of these, thank God. But there's a few things to remember. So number one, the healing environment matters, okay? Roger Ulrich is a famous environmental psychologist in the 1980s, and he really pioneered this research. He found that patients undergoing a cholecystectomy, whose rooms looked out onto a landscape, had lower pain requirements than those that looked onto a brick wall. Additionally, color also matters. Blue and green have been noted to temporarily reduce heart rate and blood pressure, whereas yellow and red increase them. Music in the perioperative period reduces pain scores, heart rate, blood pressure, anxiety, and also analgesic pain requirements. And more recently, the pitch and tone of anesthesia monitors has been assessed to study and optimize the soundscape of the ICU and the OR. And lastly, color landscapes and nature scenes reduce perioperative stress more than black and white, and abstract images increase them. Now, there's one person in our department who actually knew this, Musa, which is why he put this image next to the workroom on 7 Long years ago when he was a resident. But for the rest of you, you're thinking to yourself, Alicia, this is because nature has all the effects. It's not art driving, it's a confounder. Well, let's test that theory, shall we? We have a photo here taken by Terry M. from Gilroy, California. Terry gave Yosemite Falls a 3 out of 5 on Yelp. Now, I don't find this particularly life-changing, but it is a landscape, right? And I just told you that landscapes are powerful. But what about the professionals? Say, Ansel Adams, right? I just told you that color is more important and powerful than black and white. And yet, here you are drawn to the image on the right. Because the contrast, the composition, the story that the artist creates evokes emotion, not just the landscape. And I think if given the choice of color film at the time, Ansel would have chosen to depict the scene in color because once again, we see how the choices of the artist lead the viewer down a path of awe and wonder. And it's doing that for you now, sitting in these chairs. And it can certainly do that for our patients in the hospital. Now, speaking of you, what can art do for physicians? So this was an article by Dr. Kolar, a medicine attending at Mass General, who reflected on the impacts of art for physicians in the New York Times. There's countless medical school programs, such as Training the Eye at Harvard, the Art of Observation at Stanford, and a class that I took as a medical student, Drawing as a Way of Seeing at UCSD. Studies have shown that students and residents who participate in these programs were found to have more physical exam findings and broader differentials and when diagnosing a standard patient than those who didn't participate in these programs. And data has also shown that physicians who participated in art have an increased ability to discern facial expressions. That's empathy, folks. And it certainly matters. It sounds like important stuff, right? Well, I think the most important impact is here. We have a problem in our field, and it's burnout, right? Burns me out to talk about burnout. This certainly isn't a talk about burnout, but it is a talk about art as a tool. Now, I'm not going to go over the 27 studies across 13 countries about the psychological effects of art in art therapy for healthcare workers, but I will say there is a near unanimous positive effect on art's ability to combat burnout, stress, anxiety, trauma, quality of life, and emotional states of healthcare workers who participate in it. But we're not just healthcare workers, we're surgeons. So I want to take you back to the image on the opening slide. This is a 7-foot quilt made by the chief of trauma surgery at Harborview. Sounds like a stressful job. What she reflects is that art is a great way to relax and create things that we know give people joy or comfort. So in my mind, we vow to do no harm, and yet we make an incision every day without guarantees. I've seen the dot phrases for the risks benefits. So it's comforting to know there's a space where art can deliver when medicine falls flat. So on the survey, I asked folks, well, who considers themselves an artist in our department? And 2/3 of you responded either with a yes or a sort of. We're going to run with that sort of. So turns out we do a lot of art. This is amazing. And this is by no means a complete list, but a summary of those brave enough to share their work or had the misfortune of making small talk with me over the past 4 years. So who are these wonderful people? Well, we have folks who do ceramics. We have folks who carve stamps. We have folks who draw. We have photographers. We have painters. We have master textile workers with knitting and crochet. We have jewelers, which you'll see today. And we have dancers. We have enough musicians for a small band or even a large band. We have folks who can take that music to the stage. And then we have folks who can take that music to the world, or perhaps a Christmas party to a department. Take it in. This is made by all you guys. This is amazing. These are people just like you who have real jobs and hearts that are full. So what do these wonderful people say? Well, art is immensely positive, right? It is the purpose of this wonderful life equation, grounding oneself, doing something meaningful in a lower stakes environment. It's a different type of studying. And then, of course, there's folks who wish they had more time to do art. And for the 33% of us who maybe don't consider themselves an artist, well, if there's ever a sign to make art, this is it, right? So ways to get artsy today. We'll round out this section with how you can start today. Look around, right? This is the easiest place to start. I mean, how many people learn today that Musa has a photograph on 7 Long, 0 residents, and yet you're there crying every weekend, right? How many people knew that these hearts made $33 million for SFGH? So I encourage you to pause, read a plaque in the hallway, learn something about yourself. And then if you really want to get artsy, but you don't know where to start, well, these are 3 great beginner mediums to start with, all trialed by residents for the first time this year. I mean, Camille's never been happier. So, but what about ways that we can make you and your patients happy? How about visual aids in patient care? So I'm lucky to have some personal experience in this arena. This is a picture of me after my short stay at Hotel Parnassus. And the right image is a picture of my dad last week after a total hit by Dr. Berry. Now, we are both happy campers, future donors to UCSF. And if you were to combine both of our after visit summaries, though, it would equate to a small novel, okay? And despite the novel and the paperwork, I still had to review my medications with my dad multiple times until he finally said, "Why are all the bottles orange? This helps no one." I agree, and we have some room for improvement. So, is a picture worth 1,000 words? How is it working on the front lines? Well, Cohen et al. In the Surgical Education Journal reviewed the impact of visual aids in patient care. Using visual aids has been shown to increase surgical patient objective knowledge compared to controls by 4 times. 2 studies showed that patients who used these visual aids had improved postoperative medication and analgesia requirements, and 2 demonstrated their medication compliance was also improved as well. Patients exposed to anatomical models were more satisfied with the surgeon's interpersonal skills and consenting process than controls. And the image on the right is just an example of what one of those visual aids can look like in your clinic and how they can answer common questions in any field. But our visual space is rapidly expanding from the 2D to the 3D. So St. Jude's Hospital recently teamed up with a VR software company, Z3VR, to create a virtual therapy space for hospitalized children to prepare for surgery specifically. And this isn't just a landscape where they can interact and choose an environment of their choice. It's particularly designed for them to prepare for the journey ahead. When they interviewed children, they actually found common themes of hospitalization included isolation and poor coping. And so this VR space allows a patient to interact with an AI astronaut, modeled off of retired astronaut Nicole Stott, as she reflects on her own isolating journey. The patients are encouraged to ask their own questions, say, what object would you take to space? And astronaut Stott responds with vulnerability and wisdom as she prepares for her next mission, so patients can prepare for theirs. Well, what if you're seeing 25 patients before 11 a.m. and all you have is a pen that you borrowed from a resident? Well, if you're Dr. Ma, you're going to draw a live comparison of the data. This is a rendition of his famous ACL doodle. And it doesn't take a survey to know this works. You watch as each patient leans in and makes an informed decision alongside Dr. Ma, and then they either rip off or take a picture of that to reflect on later. So it's worth the investment to practice your live artwork because this takes a minute and a half. I've been there. And it's going to benefit both you and your patients. But what if you want something more sophisticated and you aren't a graphic designer? Well, we've seen the billboards. If you don't know, Canva is an amazing free design resource that allows you to quickly modify hundreds of templates to make your own graphics. And this is a video of me, not sped up, this is live, modifying a brochure template for diabetes for orthopedic surgery. I chose this generic template, and you can see how quickly you can search orthopedics, find your own images, use the magic AI-generated suggestions, and it's a really simple and effective way to educate our patients with art. If you can use PowerPoint, you can use this tool. And right now it's still free. So how can art educate us? And has it already? Well, I asked our department their learning style. And no surprise, a group full of orthopedic surgeons are 60% visual learners, 25% kinesthetic, and then I think the remaining 13.9 are carrying our OITE scores on their backs. I asked a follow-up question regarding the role of art in medical education, and an overwhelming 80% either agreed or strongly agreed that art has a role in medical education. Now, we've gone over a lot of images, but who remembers this one? Raise your hands, keep them high, be proud. Oh, there it is. That's a lot of hands. It's the first one we've had. Certainly. Now, if you're thinking to yourself, well, that's Bartonella. Well, for the folks who didn't raise their hands, this is a sketch of Bartonella Hensley from Sketchy Micro. It's a digital learning platform that takes an artistic spin on the memory palace. So the memory palace is a technique of memorization that's been described for centuries. And the original described memory tool in psychology. You visualize yourself walking in a palace, picking up the treasures of the memorized items that you need to facilitate recall for hundreds of terms. And for a fee with Sketchy Micro, you get access to hundreds of these videos that draw a scene using visualized mnemonics to memorize information quickly, but also lastingly. Who wants to test their lasting knowledge today? Raise your hand. You can use a friend. We're going to do this live. Ramesh. Oh, we have an intern. Andrew, get up here. No, you can stand there. What does the cat represent?
My interns helped me out here, but cat scratch disease.
Amazing.
Bartonella.
What about the armpits?
You get these like inflamed lymph nodes
Lymphadenopathy.
with
Okay.
Bartonella.
What about the wheel?
That's a treatment. That's a tetracycline, doxycycline.
What about the crow?
Another treatment for macrolides.
Incredible. And then lastly, this one might be hard. What about the Van Gogh Starry Night? Silvery and starry.
Phone a friend.
Rachel, what would you say?
I can't exactly remember, but did that you grow out like silver agar or something?
Useless information, and yet these people got 100%. We haven't thought about this in years, right? So this is the power of a visual aid, and it's one that everyone in this audience on the resident side has used, and it's lasting. Pretty impressive. Now, Sketchy wasn't alone, right? There was a whole slew of other resources during my era of medical training. And one example was Pixarize, which really filled the memory palace gaps that Sketchy missed. And Osmosis, in a very structured way, is actually a live drawing of a cartoon of various topics that cover everything from cardiology to pharmacology. And then, of course, who can forget this bald man? In his whiteboard teachings, he became a part of your family. But they'll set you back, right? Anywhere from $250 to $430. But you're not just buying one, you're buying a few, and maybe you're collecting the whole set, which means that you'll be spending upwards of $2,000 a year. Was it worth it? Well, let's look at the mean step 1 scores from 1997 to 2022. And let's just trend where these different resources started until the pass-fail. So the whole purpose of pass-fail was really to offset the enormous, inequitable cost of those resources that drove testing disparities. But it doesn't mean they didn't work, right? So what about orthopedic surgery? Well, you take all these successful test takers and human beings who relied on structured, artistic, visually captivating learning platforms with videos that averaged 11 minutes, and they match into orthopedic surgery. And then you put them in an ocean with a book and a few disconnected, incomplete buoys, and you ask them to thrive. I think we can do better. And I think we have a blueprint for what works. But how do we get there? There's certainly some motivated folks in our department and some amazing tools that we've started. We're going to have to collaborate. We're going to have to find the right people in our field and beyond. We're going to need to find the best educators and the best learners of every subspecialty. And then we're going to have to take artists to collaborate with engineers, to collaborate with surgeons. And then we're going to realize that that takes a really, 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 really long time. And I graduate next year. And so then we're going to have to use AI to get us there within our lifetime. Now, I know what you're waiting for. You're waiting for the next slide to say, this is it. This is what we're doing. But number one, I don't have a crystal ball. But two, I've given you a really good blueprint of some tools that work. And what I'd rather do is challenge you to visualize what that future is going to be like. What that future is combining art and science and the expertise of the people in our field to really make a future that is both beautiful and memorable. That is my challenge to you. So, final thoughts. Art matters, okay? It's mattered to me every day since I was 3 years old, and it's allowed me to see and feel the most wonderful things, and I hope that it can do that for you, okay? I want you to remember that there is an application of art in orthopedic surgery, and the history is both broad and ancient. I want you to also recognize that art's a powerful tool. And we've recognized that it can be a tool and have value for yourself, for your patients, and for the future of surgical education. I want you to get involved, okay? And this will show up at the end too. But here is a QR code of some patient care tools. Canva, I didn't have time to talk about Doodly, but it can help create some of those live drawings and record them onto a video. I've got books and TED Talks that I've reflected, and certainly some programs from UCSF and Creativity Explored. And then lastly, of course, thank you all for the opportunity to make art in the name of orthopedic surgery and social change. There is so much more to learn and explore. Thank you to my mentors, Dr. Wustrak, Dr. Feely, Dr. Diab, and of course, my family. This is Derek, after he has listened to my talk way too many times. I hope he gave me 2 thumbs up this time. And then, of course, my brother, as well as my parents, and Frida Kahlo. So these are my references. Thank you all.
All right. Thanks, Dr. Asturias. That was fantastic. And we have a little bit of time left for discussion or questions. Any thoughts on? Yes. Here, we'll get you the microphone.
The difficult question I already asked you, but I think that you shouldn't have to defend art in orthopedics specifically orthopedics. You guys have all heard me say this. I repeat myself all the time. The Hippocratic Corpus has got 3 books dedicated to orthopedics, 3 out of 13. So we are the OGs of surgery, no other field, in fact. But also, if you think about the so-called father male of anatomy, Vesalius, that's art. You've seen those lithographs, and that's from the 15th century, and that's what everybody looks at, and that is just sheer beauty. And I think that for me, I mean, I'm now the old guy here, the thing I enjoy the most about surgery is the appearance. I just love the beauty of it. I just love the dissection. I love putting things together, and that's art, and that's orthopedics. It's right there in our core.
I couldn't agree more. Between Vesalius and Netter and following the whole anatomic history of orthopedics, I had to take some things out. And so I think future iterations of this talk certainly include all of those extra pieces. And of course, the things that we do every day. It's beautiful. It's amazing. We're so fortunate and privileged.
Alicia, of course, I loved every minute of that talk. That was really great. So just, 2 questions for you, or asks, I guess. One, I'd like you to kind of challenge us with one thing we should all do this week, like one accessible art thing we could all do this week. Then I'd like to know from your talk, what are you going to try to incorporate in your practice? What do you think will be the most important thing for your future practice as an orthopedic pediatric surgeon?
Yeah. I wasn't kidding. I think the easiest thing that you can do is look around. Art is everywhere. It is everything that we do, everything that we strive for, and it's on the walls in the hospital. So take a moment, look at a piece of artwork, give yourself that moment of mindfulness. That's why it works, and that's why it can help you. So take those moments. In terms of things that I'll take into my practice, I actually love Dr. Ma's technique. And every time I see it, I think of the ways that I'm going to describe a skiffy or a supracondylar fracture, or all of those different techniques and how to guide patients. And I think maybe one day those can be turned into videos that patients can easily refer back to, or I can draw on an iPad and upload that right directly into their phone. So these are things and tools that I envision myself using in the future.
A great talk. I mean, I didn't know what to expect when I heard the, title, but very, very impressive, and I think that you get us to think outside what we're going to commonly do. I really appreciate it. The other thing I will also say is that every one of us are artists, right? Don't we all admire the post-op X-ray, when you're going to finish your operation? So how great that, that reduction of that tibial fracture is, how awesome the rotator cuff come together, how great that spine surgery go from head to toe. They're actually nice and straight right now. And so, I want, make sure that everybody understands we are all artists in our heart. It's just we don't admit it sometimes. And I really thank you for bringing it out to us that, sometimes we just need to look beyond what we do and to make a bigger impact. I think that, patients obviously have different needs and different way they perceive, things in art also. So we need to be respectful of that. But, thank you for doing it. This is really great. Really awesome. Keep it. Yeah.
Thank you. Thank you. Another question from the audience.
This is an amazing talk, Alicia. My question and how I justify my incredibly expensive knitting hobby is that like the dexterity of just actually knitting, of surgical skills. We have an incredibly hands-on profession. And how do you think that kind of the hands-on aspect of it relates to surgical education.
Totally. I think back to actually a talk that Dr. Schroeder gives of really encouraging women to go into orthopedics. I think there's often a stigma that, oh, we don't use power tools and we don't use saws, but I've been doing art since I was 3 years old. And if that didn't play into my dexterity or how comfortable I feel in the operating room, well, I'm not sure what does, right? And I love the knitting piece. I think that all of us could use a little extra help doing arthroscopy. And so I think it's certainly going to play into that.
All right. Well, Dr. Asturias, thank you so much. This was fantastic. And